have Mrs. Jones here. She's 30 years old. She just came to me from the emergency room.
At FHN Memorial Hospital in Freeport, Illinois.
Any pain going down your arm or up into your neck at all?
No, I feel pressure in my chest.
Intensive care patients are getting an extra layer of care from experts 65 miles away. Critical care doctors and nurses at UW Health in Madison, Wisconsin are monitoring the patients 24 hours a day, 7 days a week with an electronic ICU program called eCare of Wisconsin.
Pain in your arm, going up into your neck.
I tell all my patients and their families, you have the advantage of physically being in Freeport, which is convenient for families, but you really have one leg here and one leg in the ICU at UW.
They're continually monitoring our patients, but not assuming the care. So if I come into the room and I'm thinking, something isn't right, I can push a button and get another person immediately in the room.
They can look at your blood pressure, your pulse, your temperature, your blood work, your lab work, everything on the computer that I can see, including my notes, the notes of the cardiologist, etc. They have full access to everything.
I took a look at her chest x-ray and that actually looks quite normal.
And with the use of two-way video cameras, the experts at UW Health can interact with caregivers in Freeport as well as patients and families within seconds.
A lot of my interactions are with the nursing staff, but also really anybody who comes into the room and is involved in patient care. What I find very gratifying is being able to talk to the patients directly sometimes. The other aspect is the ability to voice opinions and provide information to the patients' families that's so critical in their settings.
The UW Health critical care physicians and nurses can also provide a wealth of experience that comes with seeing a high volume of critically ill patients.
We've seen these septic or sick patients hundreds of times. And so when you look into a room, even from a video or from looking at their medical records and visiting with the patient, you just get a sense of their illness.
We enjoy having that expert set of eyes looking at our patients.
Our most critically ill patients are able to stay in their neighborhood, their families have a short distance to travel, and they're receiving the benefits of having the UW collaboration with FHN to provide care.
So a little extra oxygen might help you feel better.
And one of the other things that we saw was that our patients' recovery time also was shortened as well, which adds to that theory that in addition to providing exemplary care, one of the most important things that we shouldn't understate is family support right there at the bedside.
In addition to providing enhanced patient care, the eCare program at UW Health also serves as a valuable recruiting tool for community hospitals looking to hire and retain staff.
I think when we are talking to nurses who are interested in working here and we're able to tell them that we have access to UW and to the eCare, they are wowed by that. They know that they have that resource available to them and that layer of care available in this small rural setting. It's something that they're attracted to.
A lot of our sites might staff with 2 nurses, and if they staff with 2 nurses, one nurse is new to the ICU, our nurses can check in and provide a really great post-orientation mentorship.
From a staff perspective, it really allows us to collaborate with UW and care for those higher acuity patients that, again, we wouldn't be able to normally care for. When you look at professional growth and what it does for our nursing profession, that's also really a very positive thing for us.
Listen to your stomach here.
The thing that people focus on is the bedside care. As we get information from the patient's medical records, that information then gets organized into reports and looks for best practice. It's not only that patients are staying in their community, but you can show them and participate with them in making that care great. And so that they can be very confident that when they stay there, that the care is at a high level.
eCare of Wisconsin, a service that can reduce patient stays, improve outcomes, and help save lives.